Tumors of the uveal tract. Anatomy of the uveal tract. Uveal tract is the intermediate vascular coat of the eyeball. It is composed of the following structures: anterior uvea formed of the iris and the ciliary body, posterior uvea formed of the choroid. Iris. This is the anterior circular pigmented diaphragm of the uveal tract. The pupil is the central aperture. It divides the space between the cornea and the lens into anterior chamber and posterior chamber. Gross anatomy of the iris. The iris has two borders and two surfaces. Borders: pupillary border and ciliary border, which is attached to the middle of the anterior surface of ciliary body. Surfaces: anterior surface shows fine irregularities, iris pattern. Posterior surface is smooth and darkly pigmented. Iris pattern: fine anterior irregularities on the anterior surface of the iris. It includes collarette, which is irregular circle near the pupil, radial striations, circular furrows, and iris crypts, which are depressions near the collarette and the ciliary border. Color of the iris. At birth, it is usually light colored. The permanent color is reached by 1 year of age, depending on the amount of pigment in the stroma. Minute anatomy. Anterior border layer, dense fibroblasts with interconnecting processes, and melanocytes. Stroma, connective tissue containing blood vessels, nerves, and pigmented cells. Iris pigment epithelium, formed of 2 layers of pigment epithelium. Anterior pigmented layer, formed of flat cells, and posterior pigmented layer, formed of cubicle cells, reflected onto the anterior border of iris stroma. Both layers are continuous with ciliary body epithelium. Iris muscles. Sphincter pupillae muscle, circular band of smooth muscles running around the pupil, with parasympathetic innervation. Dilator pupillae muscle, radially arranged smooth muscles running from ciliary border to pupillary border, with sympathetic nerve supply. Blood supply. Arterial. Circular iridus major is formed in the ciliary body by the union of anterior ciliary arteries, which are 7, and 2 long posterior ciliary arteries. Radial branches from the major arterial circle pass along the iris stroma towards the pupillary border, where they anastomose, forming a minor arterial circle. Venous. Iris veins drain into the vortex veins. Nerve supply of the iris. Sensory. 2 long ciliary nerves. Motor. Sympathetic supplies dilator pupillae muscle. Parasympathetic constrictor pupillae muscle. Function. Iris crypts assist in aqueous drainage. The pupil controls light entering the eye, increases depth of focus, eliminates spherical and chromatic aberrations by cutting the peripheral rays. Ciliary body. It is the intermediate part of the uveal tract. It extends from the iris to the choroid. Gross anatomy. It is triangular in shape in anteroposterior section. Base, anterior surface, carries the iris insertion in its middle. Outer surface, separated from the sclera by the supraciliary space. Inner surface gives origin to the zonular fibers, divided into 2 parts: pars plicata, anterior part, and pars plana, the posterior part. Minute anatomy. Ciliary processes. 75 processes, vascular connective tissue core covered by epithelium. Ciliary epithelium continues with the iris epithelium, inner non-pigmented and outer pigmented epithelium. Ciliary muscles. Longitudinal outermost, extends from the sclera spur to the suprachoroid lamina. Oblique, connects longitudinal and circular fibers. Circular, innermost, forms a ring around the ciliary processes. Blood supply of the ciliary body. Major arterial circle, venous drainage into vortex veins. Nerve supply, parasympathetic. Function. Inner non-pigmented epithelium forms aqueous humor. Ciliary muscles, circular fibers, play a role in accommodation. Longitudinal fibers assist in aqueous drainage. Choroid. It forms the posterior part of uveal tract. Minute anatomy. Bruch's membrane, with the retinal pigment epithelium resting on it. Stroma, formed of choriocapillaris, intermediate blood vessels, and large-sized blood vessels. Suprachoroid lamina, where the nerves and the melanocytes lie. Function, nutritive to the outer retinal layers. Embryology of melanin-containing cells. Melanin-containing cells include pigment epithelium. Pigment epithelial cells are neuroepithelial in origin. Embryonic optic cup. Melanin-containing cells include pigment epithelium of retina, ciliary body, and iris. Pigment epithelium gives origin to the following tumors: adenomas, adenocarcinomas, and medulloepitheliomas. Melanin-containing cells include uveal dendritic melanocytes, chromatophores, originate from neural crest primordial cells, neuroectodermal in origin. Chromatophores reside in stromal component of uvea. They are elongated star-shaped cells with long dendritic processes, with fine dust-like pigment granules. Cells of origin of most intraocular pigmented neoplasms, nevi, melanomas, and melanocytomas. Melanin-containing cells include pigment epithelium and uveal melanocytes. Pigment epithelium originate from neuroepithelium, embryonic optic cup, located in iris, ciliary body, and retina. Formed of sheet of cuboidal cells with large granules. Pathologic changes include hyperplasia and rare neoplasia into adenoma, adenocarcinoma, or medulloepithelioma. Uveal melanocytes. They are neuroectodermal in origin, neural crest primordial cells, located in the stroma of the uveal tract, conjunctiva, and dermis. Formed of solitary dendritic cells with fine pigment granules. Pathologic changes include neoplasia, forming nevi, melanocytomas, or melanomas.